Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and here are the latest reports from the world of medicine. Theophylline, a potential drug for treating COVID-19 associated sinus bradycardia. COVID-19 continues to pose a global threat. With worser outcomes, new treatments are being discovered to manage this deadly virus. A recent study has suggested that a short course of oral ethophylline and theophylline prolonged release tablet could be used for treating sinus bradycardia due to COVID-19 in the future. The findings that has been published in the Journal of the Associations of Physicians of India showed that sinus bradycardia due to COVID-19 is usually transient and responds well to this drug. The insertion of a pacemaker, however, becomes difficult due to the pandemic scenario, and the risk of infection spread to the additional staff is also involved. The researchers further found that the drug to be safer than those other modalities for the treatment of sinus node dysfunction associated with COVID-19. A new study discovers a novel technique for glucose delivery. Blood glucose control is one of the most crucial steps in controlling diabetes mellitus. Glucagon offers a key antagonist to insulin in responding to hypoglycemia by releasing the glucose which is stored in the tissues so as to restore the normal blood glucose levels. In a new study published in the Journal of the American Chemical Society, the traditional use of glucagon is preferred as a preventive measure than its previous emergency use. In this study, a group of researchers demonstrated how they successfully developed hydrogels that remain intact in the presence of glucose but slowly destabilize as the levels drop, releasing the glucagon into the system, raising the glucose levels. This general strategy points out to a new paradigm in glucose-responsive materials, leveraging the concept that glucose can act as a stabilizing cue for responsive glucagon delivery in combating hypoglycemia. Chili pepper consumption may lower mortality related to cardiovascular disease or even cancer. Diet and nutrition play an important role in the prevention of mortality and cardiovascular diseases. A recent study in the American Journal of Preventive Cardiology reported that regular consumption of chili pepper is related to a significant lower all-cause cancer and cardiovascular-related mortalities. The American College of Cardiology as well as the American Heart Association has recommended plant-based and Mediterranean diets for the primary prevention of cardiovascular diseases. Modifying the diet intake, such as reducing the sodium intake, refined carbohydrates and saturated fat, and even limiting sugar, red meats for that matter, has shown to reduce the mortality risk compared to standard Western diets. Roundworm associated with lower lung function and asthma in younger males. Parasitic worm infections are normally considered to be a problem only in low and middle income countries. It has previously been assumed that infections of roundworms have not been of much significance. For persons affected, this may result in serious lung damage with the risk of having a long-term impairment of lung function. The study finds that younger men that have been exposed to Ascaris, that is the roundworm, has a striking reduction in lung function and nearly 5 times higher odds of having asthma compared to those who were non-exposed. These effects were independent of smoking and other exposures such as even house dust mites. A curious finding in the study was that among women, however, lung function was not significantly lower in the Ascaris seropositive group. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.